All right, it's only been, what, less than a day now. Senate GOP plan, though, is getting a hit for what critics are calling deeper Medicaid cuts than the House plan. To the Centers for Medicare Medicaid Services Administrator Seema Verma. Seema, I thought you could help us out with what's true versus what's not. To hear a lot of Democrats tell that the program is being gutted, is it?
It is that is not true at all. I think we have an incredible opportunity here to improve the Medicaid program. I mean, this is a program that's been around for 50 years, and it's supposed to be taking care of our most vulnerable populations, our aged, our blind, disabled. And the fact of the matter is, I think we can all agree that the Medicaid program hasn't performed the way that it should. And instead of focusing on improving the program, what Obamacare did was actually put more people into a broken system. And so what we're trying to do is to have the Medicaid program focus on the most vulnerable people, reframe the partnership between the federal and state government. And the way it's working today is the federal government making all the rules, putting out lots of regulations, and states are stifled. They can't innovate with their programs. They are closer to the people that they serve, and they have a much better sense of how to make these programs work better. So,
but a lot of them like the Medicaid part of that, right? They like having that Medicaid money and doing what they will and want with it. John Kasich of Ohio comes to mind. Is the message to them, don't get too used to this, or what?
You know, so I think there's a couple of different pieces when we talk about the Medicaid program and the bill. So the first piece is to strengthen the program for what the program was originally intended to serve, which is the vulnerable populations, or aged, blind, and disabled. Then we're talking about taking individuals that are currently in the Medicaid program and putting them into private coverage where they're actually going to have more choices for coverage. Just because somebody's poor doesn't mean that they shouldn't have choices about their health care coverage. So I think we're strengthening the base program, and we're focusing it on the most vulnerable. We're trying to improve the quality, improve the outcomes, and then we're taking the program and moving people from Medicaid into the private market where they're going to have more choices.
You know, the idea of more choices seems to be read on the left by having no choice, or all of a sudden all options are off the table here. If anything, some conservatives, Administrator, have come out to say, well, wait a minute, this is just a slightly, and they stress slightly smaller, omnibus government program. Who's right?
Well, you know, I think when you bring up the issue of choice, I mean, what we have going on here is declining choice. I mean, what we have is sort of the pathway to a single-payer system. I mean, we've got counties in America that have no choice of coverage. So even if they want care, even if they want insurance, even if they could afford Obamacare's double-digit increases, they can't even buy insurance. And on top of it, they're going to pay a penalty. And then we have the situation where in some areas there's only one offerer. So that means that, you know, you've got one carrier, you don't have a choice, you might not be able to see the doctor that you want to see because your doctor's not there. Or, you know, the providers that are there, you're going to be waiting in long lines, you're going to be traveling long distances. So that's a real issue in terms of choice. And then in the other areas of the country where there might be a couple of insurers, what we're seeing are double-digit increases. So after 3 years of Obamacare, we have almost 100% increase in premium. And now it's even going up even more by double-digit increases. We're hearing that some of the early filings that are coming through. We heard from Maryland, we've heard from Virginia and Delaware, and all of those premiums are above 30% in just this year. So that's not a lot of choice for Americans.
Nor is it sustainable, economically sustainable.
It is not sustainable.
Which side of the fence you're on this. Seema Verma, thank you very, very much. Good having you.
Thank you.